7 sessions. The reason being is because we had a two-part with regards to the digestive section. That was intended to be 1 session, but it was so long and it required a couple of sessions. So that's why there may be some confusion whether this is session 6 or session 7. Anyway, so today we're continuing our study into nutrition and the use of the symptom survey. Today, primarily, we're going to be looking at the nervous system and the balance of the nervous system. And we can do that now that we have a kind of a fundamental understanding of the rest of the systems up above it that we'd call the high priority groups. So today we want to see how the autonomic nervous system influences those other systems. And of course, it's wise to remember that the habits of the patient that cause the cascade of ill effects or ill health is also those habits that support good health. So today, a reminder, our ultimate goal is to get our patients eating an appropriate diet, which means managing their carbohydrate load, making sure they're moving their body, and particularly today's topic, it's about reducing and managing stress. So it's important to remember that our society is built around a state of sympathetic dominance. We have a 24-hour news cycle, which is rarely good news. And of course, we all have jobs and things that help us cope with our life. So I think it's important to remember as we kind of go into the nuts and bolts of what we're looking at, we need to not forget that we're treating patients, we're treating people with lives outside of our own. So it's important to pay attention to that, as well as how so many of us are burdened by quite a lot of stress. So I based our quote today on that, and I think it's a pretty valuable quote. And this is from Corrie ten Boom, and I think that's a she. She says, "Worrying is carrying tomorrow's load with today's strength, carrying 2 days at once. It is moving tomorrow ahead of time. Worrying doesn't empty tomorrow of its sorrow. It empties today of its strength." So that, which we'll kind of take into our contemplation of the autonomic nervous system. So in the autonomic nervous system, or also called the automatic nervous system, is that area of the nervous system that works without our conscious thought. So the two divisions of that is the sympathetic nervous system and the parasympathetic nervous system, which is sections 1 and sections 2 of the symptom survey. So previously we've discussed the high priority groups. That was digestion, liver biliary, and sugar handling. And then last time we discussed the cardiovascular system along with some foundational issues regarding vitamins B and vitamins G. So today we're focusing in on sympathetic parasympathetic dominance. So homeostasis, or balance, is that ideal for optimal health. It's when the sympathetic and the parasympathetic become imbalanced, the patient is out of balance. They're out of sync with their environment. So a wise practitioner supports balance, but never neglects to listen to what the patient is asking. So to do so may require supporting digestion. It may require supporting an endocrine system, looking at cardiovascular, or reducing a toxic burden. So make sure that though we're looking at the symptom survey, we're always paying heed to it, pay attention to the patient's core issues, making sure that we're keeping their needs addressed. Doing that will foster successful practice. So again, the autonomic or automatic nervous system has 2 divisions, the sympathetic or fight or flight division, and the parasympathetic, or the rest and digest side of the system, which is sometimes called the feed and breed side of the system, with the ultimate goal of being homeostasis. So if we think of the autonomic nervous system as a bit of a teeter-totter, of course we've got rest and digest on one side and fight or flight on the other. And homeostasis is that ability to be constant. So homeo means constant. Stasis is Greek for stable. So homeostasis, another way to think about it, is something that is constantly stable or has constant stability. So when we look at our, the heroines or the heroes in our environment, these are people that have a remarkable ability at maintaining stability, being constantly stable, irrespective of the surroundings around them. So I always think of James Bond as being a very archetype of the person with homeostasis. He's ready to make love on one hand, or he's ready to save the world on the other. So he can be very fight or flight, or he can be very feed and breed very quickly. So with that in mind, we'll kind of move into some of the physiology that we like to address with each of these presentations, and that's just the simple idea of this division and where it comes from. So when we look at the parasympathetic division of the nervous system, this is coming from primarily the cranial nerve 10, that's the vagus nerve, and that controls the parasympathetic side, or kind of the slowing, relaxing, secreting side of the ANS, the autonomic nervous system. Whereas the sympathetic side of the nervous system tends to come from more of the thoracic spine, where we find what's called the sympathetic chain ganglia. And so for those people that love the idea of kind of reviewing things from school, remember that the preganglionic neurons release acetylcholine in the parasympathetic nervous system, and so do the postganglionic neurons. So when those neurons actually, hit the heart or the lungs, that neurotransmitter from the parasympathetic division is going to be acetylcholine. So if we had the ability to put acetylcholine on a heart, it would slow it down. It would constrict the bronchi in the lungs. It would stimulate salivary gland secretion. It would get the pupil to constrict. Similarly, the sympathetic division has acetylcholine as its preganglionic neurotransmitter, so that neurotransmitter released at the preganglion is still acetylcholine, but at the end organ, that neurotransmitter is going to be norepinephrine. So norepinephrine, similar to epinephrine, we think of as adrenaline, and adrenaline is associated with our fight or flight response. So we would expect it to do things like dilate the pupil, get the lungs opening up and oxygenating more efficiently, turning off some non-vital things like digestion, and obviously, inhibits the need to urinate and gets things moving so that you can run and you can fight. So in previous presentations, we've sort of talked about some of the subjective findings and some of the objective findings with the exams that go along with them. And today I think it seemed pretty self-explanatory that most of the subjective findings are pretty much found on the symptom survey. So we're going to address those later as they come up. But know that most of the time when there is a patient complaint or issue, it's going to be fairly similar to what we're finding in the objective information. So one of the things from an exam or an objective standpoint that I look at with my patients is their pupils. It's a good place to kind of address where they might be right now in the office. So my office is sort of modestly lit. I wouldn't say it's bright, nor is it dim. So the normal pupil size varies from about 2 to 4 millimeters in a bright light, and it varies from about 4 to 8 millimeters in the dark or in a really dimly lit room. So we can sort of assume that the normal pupil diameter is going to be right about 4 millimeters right there. So if I see what I would call a more tightly constricted pupil on a patient in a room that's not terribly bright but slightly bright, I would start to consider that maybe they've got a little bit of a parasympathetic dominance. By the same token, if their pupils are really big, I might need to take a defensive stance. It's possible they're moving into fight or flight, or they're just always sort of set there. They may have a very stressful day. They may have just almost gotten run over by the tractor trailer truck on the interstate on their way to their visit. So obviously important to correlate what's going on in that patient's life at the time, but know that in general I want to see it right about 4. Now, this little picture over here doesn't really have anything to do with the sympathetic parasympathetic balance, but I always think it's good to kind of review some of the information that we learned in school that we just don't see that often in clinical practice. But what we do know is that the pupils are going to be the same size. If they're not, that's usually worth asking the patient a few questions. In 15 years in practice, I think I've had 2 or 3 patients that have had remarkably 2 different sized pupils, and virtually all of them have had some sort of eye trauma when they were younger, and that's the reason why their pupils are the wrong size. But assuming that you were looking at pupils and doing a neurologic exam, and then you shine that light into that patient's eye, you would expect the other eye to consent or to move at the same rate. So that's called the consensual reflex of the eye. If you shine the light in the eye and the opposite side does not consent, you have lost consensual pupillary reflex, and that's a nerve root lesion. That's if you see that, that's a brain tumor until you rule that out. So remember that loss of consensual light reflex, if they don't have a reason for it, is a good opportunity to get an MRI of their brain or refer out to a neurologist. Similarly, if you shine the light into the eye and the pupil doesn't do anything, but the other pupil does, then that's a loss of the direct pupillary light reflex, which is cranial nerve 2, or that optic nerve is lesioned. So again, they would have an explanation for that, and if they don't, that's a good time for a neurologic referral or workup with an MRI. So some more objective information that I'm looking at with my patients is how do their eyes look? Do they have cracks in the corners of the lips? So I'm kind of looking at this from a dry mucous membrane standpoint. So if you've got dry, tired, red eyes, I'm thinking first and foremost about maybe looking at their essential fatty acid status, making sure they're taking a fish oil. That's why I kind of superimposed the old tuna over oh, I can't even remember his name. Anyway, again, cracked lips, that can be simple essential fatty acid issue. Uh, over the long term, it could be something that's sympathetic or parasympathetic, because we do know that when we're sympathetic dominant, we tend to have less secretions. However, when I see the cracks in the corners of the lips, this is also a good time to remember that B vitamins, particularly their deficiency, can cause some problems there. So there's a lot of correlations to dry skin and dry mouth and things like that. Another thing to consider is chest sounds or wheezing. Not all of our patients are obvious. They don't come in wheezing audibly like Darth Vader. So when I'm listening to heart sounds or breath sounds, I take note. If I hear some wheezing, most of the time that's going to be a patient with asthma. But being in the parasympathetic state or parasympathetic dominant will tighten those bronchi and create some wheezing. So it's not uncommon for an asthmatic to be a person who tends to have a more dominant parasympathetic response. The other thing that's pretty obvious with a fight or flight response is that our heart rate goes up. So there was a couple of really good studies in the last 20 years on the importance of heart rate. And I like to educate people on simple tests that are virtually free, so everybody can take their pulse when they wake up in the morning. So what these two studies told us, and so this one is some of you may not be able to read the slide. I took it directly from the article from the journal, but basically what it's saying is, according to this study, the resting heart rate, or the number of heartbeats in the minute during rest, predicts the risk of cardiac event in middle-aged women regardless of physical activity, smoking, or other risk factors, including things like diabetes. So then it goes on to say the results, which confirm previous findings in men, are based on data from the Women's Health Initiative. So over here in this little blue highlighted area, this was the study that they did on men. And I think they started that in 1985, and then they said, 16 years later, in the year 2001, the researchers checked back on those men that they checked their pulse, and found that 39% of them had died since they had checked them in 1985. And when they correlated the data, they found that men that had a heart rate between 51 and 80 beats per minute had a 40 or 50% increased risk of death. That's pretty profound. And that has nothing to do with whether they were obese, had abdominal fat, or diabetes, or any other risk factors. This was a completely independent risk factor. The thing to take note of is that if their pulse was between 81 and 90 beats per minute, it doubled their risk. compared with the lowest rate. And if they had a resting heart rate above 90, it tripled their risk. So very similar findings were found in the women, which was basically down here during the 8 years of this study, 2,281 women suffered a heart attack or coronary death, and close to 1,900 had a stroke. Women with the highest resting heart rates, more than 76 beats per minute, were 26% more likely to have a heart attack or die from uh, one of those lowest heart resting rates. So, kind of an ideal goal we'd like to get our patients to is probably 65 beats per minute or less, even though there's still some risk right here, 51 or higher. Ultimately, the lower the better. So that sort of begs the question: what's too low? And I think you have to look at the health of the patient. So when I think of the elite athlete, the Diana Nyad, the gal that swims from Cuba to Florida and the English Channel, her resting heart rate I think is remarkable. It's like 20 or something remarkably low. Her cardiovascular conditioning is so profound. Her heart beats once and just boom, oxygenates the system, and it just doesn't have to do that much work. So in the elite athlete, I would expect lower heart rates. But if you've got a patient on your table who's a little obese, has other cardiac risk factors, but their pulse is, 40, that's probably a state of parasympathetic dominance and something to concern yourself with, and look at some of the other areas of the symptom survey that may correlate that. And if that's the case, then we've got some strategies we'll talk about in just a minute. So the next thing we can talk with our patients about that's objective is their gut transit time. And I don't put a lot of energy or clout on gut transit time because it is fairly variable, but it's a simple test and it gives us some information. And it's fair to say that if you eat something, you should be pooping it out between 12 and 18 hours later. That's a pretty wide range and a fairly decent average. So the thing to remember is that we would like to see the food that we ate coming out in short order. Just because you poop every day doesn't mean that you have a normal transit time. So one of the ways that I might do that is have the patient eat some corn and then tell me, how long or how much later did it come out. So if you eat supper at 6 o'clock, I would expect it to be coming out the next morning or around lunch the next day. If it's coming out 4, 5, 6 days later, that's a very slow transit time. It's taking a long time for that food to move through the system. So one of the things that I do with my patients is I tend to not encourage the consumption of too much grain. Corn is a grain, so another strategy you could use is have them eat some sunflower seeds and try not to chew as much so they don't get broken down with mastication. And you can track those as they go through. I think in the past I've also used beets, and because beets will obviously turn the fecal mass red, and that's a good way to test transit time. Except that I'm of the opinion if you give them beets, that tends to speed transit time. So it may be possible that just simply by giving them beets, you're getting a false reading because beets tend to encourage, as we talked about in the liver biliary section with beta food, AF beta food, tends to encourage bowel motility. So it's a great product to give somebody that has slow bowel motility or some constipation because it'll help speed that up. So I don't usually use beets as a measure of transit time. And then some more objective information that I guess I don't really necessarily see, but we'll often talk about in the office is does the patient suffer with any erectile dysfunction or difficulty with reaching climax? The issue here is that really a sympathetic parasympathetic issue, which it probably is, but the problem is most of those are being treated with antidepressants. And the typical antidepressants are the SSRIs, the selective serotonin reuptake inhibitors, the most common of which is Zoloft, I believe. And the side effects of those medications is exactly that. difficulty with orgasm, difficulty with achieving climax, and some erectile dysfunction. So make sure that that's not the issue, that they're not taking an SSRI. If so, then now we've got some information to start addressing that sympathetic parasympathetic imbalance. And as always, don't forget what we've talked about before. We need to look at the clinical findings from their nutritional exam of their digestion, or from their heart, or from the biliary liver system. So don't forget to pay more attention to those high priority groups that we've already discussed. So of course, we have group one, which is the sympathetic dominant side, and I sort of think of sympathetic dominance as a person that's a little bit more wound up, a little bit more jumpy, and I think Kramer is a pretty good example of that type of person. Often I talk about Tigger of Winnie the Pooh. He's a very sympathetic dominant type character. On the other side, we've got the parasympathetic dominance. So just for fun, I'm thinking of maybe George Costanza, and you can see we've got a host of different things that is obviously a subjective finding of somebody that's in parasympathetic dominance. But I think the thing that I really wanted to address today and maybe make more clear, because at times I've been mistaken in thinking that it's an either-or system. So either a person is sympathetic dominant or they are parasympathetic dominant. They can't be both. I think it's hard to be both at the same time, but it's not uncommon to have symptoms of dominance from both sides. So the more imbalanced the person's health, the further away they are from homeostasis, the sicker, the less healthy they are. So when I think of Homer, he's a pretty unhealthy guy. He has a lot of unhealthy habits, and he is never in homeostasis. He is either over here or he is over here. So it's not uncommon when you're looking at a person's symptom survey that they may check several objects in both categories. And you think, is that possible? Well, that's normal. I get a little bit more concerned when they're definitely only on one. So know that that's why we don't look at the sympathetic parasympathetic problems first. We look at the high priority groups first, because so many of the sympathetic parasympathetic symptoms have their genesis in the high priority groups. And we'll look at some examples as we go through the symptom survey. So the idea is that the sympathetic parasympathetic nervous system is how we interface with our environment, and that has a lot to do with how we cope and respond to stress and stressful events. So to treat the body, we want to fortify our endocrine system, our hormonal system, and specifically the portion of that that deals with the HPA axis, which stands for the hypothalamus pituitary adrenal axis. And standard process gives us an opportunity to look at supporting those tissues individually, if you so chose. So, for instance, we do have a product for the hypothalamus and for the pituitary and thyroid, the adrenals, pancreas, the testicles, and/or the ovaries. So, when we're dealing with an autonomic nervous system imbalance, we think look to the HPA axis, look to the endocrine system. So we will be talking about endocrine system support throughout today's presentation, because that's how we're going to access and balance or create homeostasis in the system. So we haven't really had an opportunity to talk about how we support the glands of the body. So today we're going to take a quick break from the presentation at hand and go into just a side presentation on glandulars. So glandular products, we can think of them as particularly from standard process, come in kind of three varieties. We've got the whole gland, which you can think of as, I don't know, eating liver. We've got the protomorphogen, which comes from the nuclear material, and then we've got the cytosol extracts, which come from the cytosol. So let's kind of review briefly some anatomy of that. So, of course, the nucleus, we're familiar, is the area the cell that contains our genetic material, the chromatin and the DNA. This is where we derive the benefit from the protomorphogen. This is where we get protomorphogen from. The cytosol, of course, is that gel-like intracellular liquid where most of the cell's reactions and work occurs. And then if we take the cell as a whole, and along with the rest of its cells of its organ, that would be a desiccate or a whole glandular product. So the desiccates are the easiest to manufacture. They contain all the components of the cell. So they've even got some of the connective tissue between the cells and all of the functional tissue. So a desiccated product is a great nutritional product for many organs, particularly the liver. So again, this is the entire gland. We're taking that liver from a cow or from a pig or from whatever source, and drying it and consuming it. Now, of course, for the products that standard process, the desiccates are going to be bovine or cow source. So interesting is that the two vitamins were discovered by using desiccated liver by treating patients, and that was vitamin B12 and folic acid. So there's a host of different desiccated products in the standard process line, with the most common ones being the spleen, the adrenal glands, the parathyroid gland, and the posterior pituitary, the E manganese. So in essence, whole desiccates are typically used short-term to support an acutely stressed organ or drive a physiologic effect. So there are small amounts of desiccated material in many products. So we do have liver available, kidney, brain, pituitary. A little stomach lining is a very common desiccated product that will help with digestive function, and you'll see that in some of the digestive products. Now, the cytosol extracts are basically just taking from the cytoplasm of the cell. Of course, the cytoplasm is that homogeneous jelly-like material that fills the cell. So by extracting that cytosol and concentrating that, we're taking the components of this cell, including particularly the metabolic enzymes and the hormone precursors and those synergistic factors produced by the cell to drive an immediate reaction. So cytosol extracts are not designed to really rebuild the tissue per se, but rather to assist in the day-to-day function of a gland or a system that is operating suboptimally. So if somebody's sick, can't perform their job, you bring in a temporary worker to replace it. The cytosol extracts are excellent examples of a situation where I might give a person a fish. So one of the ways I like to think about cytosol extracts, and to some degree the whole desiccates, is that you can teach a person to fish, or you can give a person a fish. So that's kind of the old saying: what give a person a fish and he eats for a day, teach a person to fish and he eats for a lifetime. The cytosol extracts are allowing me the opportunity. Sometimes a person is so sick you can't teach them anything. You don't have time. You've got to pull their biscuits out of the fire to save them. So I'm going to give them a fish while I'm working on rebuilding and regenerating that tissue. So there are 5 cytosol extracts in the standard process line that have their own product by themselves. That's Orchex, Ovex, and there's a side product called Ovex P, Prostex, Thymex, and Hypothalmex. So these are the cytosol extracts of those organs, and a great way to, particularly with Hypothalmex, upregulate right now today that hypothalamic pituitary adrenal axis. So while when a new patient comes in, they want results not 3 months from now. They want results, last week. So it's these type products, the Thymex, the Hypothalamics, where I start to get, profound effects in the short term. That's what is going to address their concerns today. When we do that, we get better results, we get better compliance. So while it's not really mentioned as one of the supporting products for the autonomic nervous system, I think hypothalamics is a great place to start when you have a lot of sympathetic parasympathetic imbalance, because it really drives the hypothalamus component of the HPA axis. Now, many of the blended products have cytosol extracts in that. So, and as an aside, one of the things I think of is if the product ends in just EX, it's a cytosol extract, Prostex being sort of the odd man out. But if it's a blended product, it ends in Plex. So Plex means it's several products put into one container, one bottle. So Diaplex, for instance, contains pancreas cytosol, spleen cytosol, and some adrenal cytosol extract. So it's going to really help support blood sugar management as well as digestion. So to quickly review, the desiccate, that's the whole cell. The cytosol extract is just this within here. And the protomorphogen we derive from the nucleus. So the protomorphogens are extracted from the nucleus. So there are little proteins, little nucleic acids within the nucleus of this cell, and every cell of the body has its own homemade protomorphogens in that tissue. So my heart, your heart, has heart protomorphogen in the nucleus of those heart cells to tell those new cells to what to do, what to grow up to be. And in this case, it's saying, listen, cell, I want you to be a heart cell. So we also, this is why, this is why stem cell research is so interesting and unique. So a stem cell is a pluripotential cell, which means it can grow up to be anything. That cell can grow up to be an eyeball cell, or a liver cell, or a heart cell. So what tells that pluripotential cell, what gives it direction that tells it to become a liver cell or a heart cell? It is the protomorphogen that does that. So that's what I'm trying to explain here, is it directs undifferentiated cellular tissue to manifest the expression of that tissue. It says, heart, become heart. So remember, protomorphogens are not whole glandular extracts. We're not getting anything but that little guy that tells the cell what to do. So all of our tissues in our body have a natural tissue antibody, or something that will clean up that debris if the cell dies. This is where we start to get into the topic of autoimmunity that we're not going to address today. But so when a patient has a history of chronic disease, they have low vitality, or they have difficulty healing after a condition like bronchitis where the lung just won't heal, tuberculosis similar, the muscles just aren't healing, or some tissue is just not healing, it's a chronic condition, what has likely happened is that we've built up an excess of this natural tissue antibody, which is basically the definition of an autoimmune reaction. So the protomorphogen that we supply as a supplement, whether that be pituitrophin PMG or cardiotrophin PMG, is going to act as a decoy or remove the barrier for that cell to start healing. As long as the organ is under attack or under duress from the antibody antigen reaction, it doesn't have the opportunity to heal. So we deliver a protomorphogen so that we remove that barrier to healing. The protomorphogen doesn't nourish the cell, it doesn't heal the cell, it merely removes the burden on the tissue so that the tissue itself can heal. It doesn't deliver protomorphogen to the heart, it stays in the gut where it acts as a decoy to remove that attack away from the heart. So now the heart is under less burden and can heal, or the tissue that we're trying to address. So when we're treating with a protomorphogen, we need to remember to address, is that person getting adequate amino acids and minerals, vitamins, phytochemicals, and the unknown factors that come with eating food and not synthetic vitamins. So when we're doing a protomorphogen, it's wise that we're making sure the patient is following those ideals of eating well and taking some whole food supplements that are going to provide those nourishing components so that that tissue can heal. So you'll see that we have a protomorphogen capability for virtually most of the tissues in the body. So obviously for the heart and for the skin and for the liver and the hypothalamus, for breast tissue, you see the list goes on. And to kind of recap and review is so the desiccated gland is that nutrient-rich substance, the whole cell, the whole organ, including that connective tissue between the cells. The cytosol extract is just that portion of the cell which is derived from the cytoplasm. And it's designed to supply specific nutritional factors which affect the body immediately. So I am giving the person a fish, whereas the protomorphogen extract is more designed around taking barriers to healing or removing that immune insult or assault on the organ. And when we remove that insult or that assault, the tissue has the opportunity to heal. So that was meant to be just a kind of a brief little overview of protomorphogens and the idea of how we use those in clinical practice. But for those that really want the master to really get the best education you're going to get on protomorphogens, I would highly recommend this the autoimmune process and reaction, which Mark did last year in Denver, or yeah, Loveland. But he's doing it again in Salt Lake City in March. This is a fantastic presentation that clarified protomorphogens more than anything else to me. And you see, he talks about the decoy response of the protomorphogen. So it's not only an educational, but a really entertaining presentation from Mark, our own Mark Anderson of Standard Process West. And so when we look at the primary products that we use for this autonomic nervous system, it recommends Simplex F and Simplex M when there's a sympathetic system dominance, and it recommends Paraplex when there's a parasympathetic nervous system dominance. So I think we should, for those that may be new to the line, sort of get some understanding of what these products are. So the adrenals and the pituitary, so that's the hypothalamus pituitary adrenal axis, along with the thyroid, these are the three main tissues that we're supporting when we use Simplex F, Simplex M, and Paraplex. So basically what we're doing is I often think of Simplex F or Simplex M or Paraplex as a multi-vitamin for the endocrine system. Now understand it's not a vitamin, it's a multiple support for the endocrine system. So if I take these three products and I add, in this case, testicular protomorphogen or orchic protomorphogen, I will be using Simplex M. So Simplex, to me, I remember Sim means this is a person with predominantly more sympathetic dominance, and they're a man, because I don't want to give orchic PMG to a woman. She does not have testicles that need rebuilding. Similarly, Simplex F is for the female, a little bit sympathetic dominant. And of course, it's going to have these three protomorphogens along with ovary support. So that's ovotrophin. For the parasympathetic dominant, I'm still going to use the hypothalamic pituitary, in this case thyroid, support products with the addition of a little pancreatrophin. So we're going to support the pancreas. And that product would be Paraplex. So that's for the parasympathetic dominant. So you will notice that these three products are the same, whether this person is sympathetic dominant or parasympathetic dominant, because it's about really controlling the stasis in the endocrine system. So one thing that is not included and not mentioned as often is hypothalamus PMG, which is a great way to restore hypothalamic function, as well as its cytosol extract, which we talked about briefly, was the hypothalmex. So for someone with more acute parasympathetic or sympathetic dominance, more severe, I would be adding hypothalmex in the short term to get quick changes, and then hypothalamus PMG to help repair that tissue. So the general support for the sympathetic dominant is simplex F or simplex N, depending on if it's a male or female, and organically bound minerals. Parasympathetic nervous system general support is going to be paraplex, circuplex, and phosphode, and we'll talk about those right now. So the importance of minerals with regards to parasympathetic sympathetic balance is really written pretty well in the therapeutic, not the therapeutic food manual, the clinical reference guide. That's what this is. This is from John Courtney, where he sort of talks about the ideas of organically bound minerals and phosphode. He says, basically, organically bound minerals is an extract of the water-soluble factors from alfalfa and tillandsia. The water-soluble factors contain all of the alkaline ash minerals, the predominant ones being potassium and magnesium. He goes on to say it's better to eat food, and green plants are the best source for potassium and magnesium. The alkaline ash minerals come from green leafy vegetables as contrasted with the acid ash minerals which come from grain. Of the acid ash minerals, the predominant one is phosphorus. In a phosphorus deficiency, a person lacks energy. To say it another way, the acid ash minerals are like the accelerator on a car. They make it go. So he goes into that metaphor, which is pretty simple to explain to patients, which is if you are parasympathetic dominant and things are slow, I need to boost that energy by giving phosphode. So phosphode, I think of phosphorus as something that's going to be fire and brimstone. In fact, those little flames off of the jet or countermeasures were probably a hot phosphorus source to draw away those ground-to-air missiles. Phosphode being something that's going to build a metabolic fire and drive activity, so it's the accelerator on the car, whereas the organically bound minerals, those alkaline ash minerals, are going to be more calming, more relaxing. So that's helping to foster that rest and digest component of the nervous system. So I like to talk about Circuplex because Circuplex is a product that contains phosphode. Now, this is just my personal opinion. I have taken phosphode liquid and I find it to be very sour. It's supposed to be sour. That's what phosphorus tastes like. And I have difficulty taking it, so that means my patients will probably have some difficulty taking it too. So I like Circuplex because it contains phosphode. So I can do a phosphorus product in a capsule form that's going to help stimulate the sympathetic nervous system to becoming more active when I need that. So when I think of asthmatic patients, when I think of patients with poor circulation that need to build a little metabolic fire, I think of Circuplex as a great source of stimulating the ability to go into a sympathetic response. So again, from the clinical reference guide, we've got a little write-up on exactly what Circuplex is and does. Now, the symptom survey, when we look at the two sections, section 1 and section 2, as we start to look at some of the questions within the symptom survey, we start to see some trends where we start to see things that tend to be a little bit more digestive, hydrochloric acid and biliary related. So we'll look at those real briefly. So with regards to digestion, questions 1 and 3 and 8, 14, and 15 all have to deal with things that are happening at the level of the stomach or gallbladder. So acid foods may upset, they may have a lump in the throat, which is a gallbladder symptom sometimes. They may have a nervous stomach, their appetite may be reduced. On the parasympathetic side, we have similar digestive problems. They may have butterflies in their stomach or cramps. They may have indigestion soon after they eat. Their digestion may be rapid. They may have a very quick transit time. Vomiting may be frequent. They may have a gag reflex. These are all things that are a little bit built around the digestive function, and I did this on purpose. I've got George Costanza on both sides because it's not uncommon to see a patient responding both with sympathetic and parasympathetic symptoms. So when they have this digestive bent, remember, particularly if this is a new patient, that we want to address the high priority groups of digestion first. and see later how these symptoms in group 1 and 2 start to improve and change. So the way that I would do that is obviously I'd be looking at simplex F, simplex M, organically bound minerals. For those questions on the sympathetic side, I'd be looking at paraplex or circuplex and phosphate for the parasympathetic side. But always remembering what we've discussed previously with the high priority groups, looking at things for upper digestion and liver biliary. So last month, or 2 months ago, last session, we talked about the cardiovascular system, and of course how the sympathetic system or the autonomic nervous system stimulates or creates situations of increased heart rate, increased stroke volume, vasoconstriction when the system is sympathetic, and then of course when it becomes parasympathetic, it calms things down. And we talked about the relationship of the B vitamins in regards to controlling that sort of function. So when we look at the symptom survey, there are a few questions that sort of deal with those sort of circulatory issues, that vitamin B, vitamin G that we talked about last session. So extremities that are cold and clammy, the heart pounds after retiring, reduced appetite. These can be a lot of different things, but one of the things to think of is this a circulatory issue? Is this a vitamin B, vitamin G issue? So in group 2, of course, similar, we've got a handful of breathing irregular, pulse slows, feels irregular, circulation is poor, they're sensitive to cold. These could be the need for more B vitamins to help obviously improve ATP production, increase the energy at the cellular level. As we'll see later, some of these are also listed in another little breakdown. These could be thyroid, and we'll talk about those in a minute. So when I see those, of course, what I'm thinking is I'm thinking for the sympathetic dominant, I'm looking at the cataplex G. Again, I think of cataplex G. G, my heart is pounding. G, my blood pressure is high. For the parasympathetic side, I think of the slower, needing to speed things up, needing to activate. So circuplex containing the phosphate is going to drive metabolism. The B vitamins tend to drive metabolism, where the component of B vitamins that we call the G vitamins tend to be more relaxing, along with those alkaline ash minerals, which are found in organically bound minerals. Now, there's a couple of questions on the symptom survey that tend to deal predominantly with mineral balance, particularly status, calcium, and its delivery to the tissues. So when I see cuts heal slowly, fever easily raised, joint stiffness in the morning, muscle, leg, or toe cramps at night, my first thing that I think of is calcium tissue deficiency and delivering calcium to the tissue. So giving calcium with a product like calcium lactate or calcium lactate powder, and then of course cataplex F to help deliver that calcium to the tissues. If that's not fixing the problem, that's when I start to look more at the simplex F, simplex M, paraplex type strategy. Now, there's a host of questions that really look like thyroid and adrenal questions, and then they're on both sides of the system, and we'll look at those. So we see things like get chilled often, keyed up and fail to calm, unable to relax, startles easily. These are really common things that we would see in a person with sympathetic dominance. But it would also be things that we might see in a person with a hyperthyroid situation. So this may be a situation where you're going to have correlate, is this a hyperthyroid issue, or are they just simply set a little high in the sympathetic division? Similarly, the opposite side of that, pulse feels slow, irregular joint stiffness after arising. Again, that could be calcium like we just talked about, but it could also be a hypothyroid situation. So we may need to look at supporting the thyroid. The beauty of that is that our treatment, which is simplex F, simplex M, or paraplex, These all contain thytrophin, which is our thyroid protomorphogen. So the treatment strategy is still the same, and if you knew that there was an overt thyroid issue, you could add or additionally put the patient on some thytrophin to support the thyroid even more aggressively than just simplex FM or paraplex alone. So there's a few other symptoms in the symptom survey that don't really fit anywhere else, and they're predominantly things that we think of with an overt sympathetic reaction. For instance, when I have to get online and give a webinar, I get a dry mouth. It's a little sympathetic reaction that I get because I guess I can't run away. When your pulse speeds up after meals, or the person that is staring and doesn't blink very much. These are all common sympathetic signs. Similarly, really common parasympathetic things are eyes, nose watery. Any secretion tends to be a parasympathetic activity. However, a lot of these in this list have some things that you would need to correlate. So if I've got a person with eyes and noses that are watery, or their eyelids are puffy and swollen, I'm thinking perhaps they may have an allergy or food sensitivity. So that, is it hay fever season? Is this something that I'm going to have to work up more as an allergy and not a sympathetic parasympathetic dominance? Same thing, hoarseness frequent. That could be an asthmatic patient who is on an oral inhaled steroid. Inhaled steroids cause a lot of voice and throat problems and hoarseness, so make sure that it's not that. But remember that asthmatic patient probably is a parasympathetic dominant person anyway. That's why they're subject to more frequent colds and asthma and bronchitis. Same thing, constipation, diarrhea, alternating. Uh, that can be the person on the teeter-totter shifting from sympathetic to parasympathetic dominance, but it can be obviously food allergy or a digestive problem, which is why often I'm not paying attention to groups 1 and groups 2 on new patients as much as I'm paying attention to their high priority groups. So this is a good example of my side manner. You're not dying, you just can't think of anything good to do. So yeah, to review what we just talked about, that pulse speeds is food sensitivity. That dry mouth and nose could be a vitamin A, vitamin C, or an essential fatty acid need. Also on hoarseness, I didn't mention that sometimes that can be a parathyroid function, which if they're going to have a problem with the parathyroid, which obviously controls calcium, they may be also having those symptoms of Charlie horses and cramps and things like that. So keep that in mind as well. So that's pretty good timing. We're at an hour and almost 1 hour. So I'd like to remind you life moves pretty fast. And if you don't stop and look around once in a while, you'll miss it. Which goes hand in hand with Corey ten Boom, where she says, there's no use in worrying about tomorrow. We need to pay attention and look around at what's happening today. So, with that in mind, there is some upcoming educational events. There's a whole bunch at Standard Process West. I couldn't list them all here. So the link on the presentation, this will take you to the SP website where all their upcoming events are. And of course, the monthly Montana Nutrition Collaboration, which is the second Monday of the month from 1 to 2. That's normally posted on the Park County Chiropractic webpage. I believe next week that presentation will be Dr. Michael Gaeta, and also a shout out to Mentoring the Mentors from Dr. Stuart White, which is every other month on the fourth Thursday from 6 to 7. So I'd like to thank everybody for joining us. And next time, that'll be, this is February, March, April. So in April, we'll be reviewing session 8, which is the endocrine system. So going into more depth with regards to hormones. So I'm going to shrink the presentation down, and if there's any questions, you can go ahead and throw them in the chat menu or chat window, and we'll address those as they come up.